Good day. I'm James Thomas O'Donnell, and I'm going to be sharing some thoughts about drug-induced falls. Um, Drug-induced falls. Well, what does that mean? Well, um, falls increase morbidity, sickness, and mortality, death. The older a person gets, the more disease they uh, experience, and the more medications that are prescribed to help relieve their ailments and try to maintain their health. Uh, Unfortunately, a number of drugs increase the risk of falls, and the primary drugs that do that are drugs that sedate patients. They're called sedative hypnotics, and they may be just for anxiety, or there may be drugs that are used to help tranquilize the patient. Other drugs that are used to treat allergy, sedate the patient. Drugs that are used to lower blood pressure if the patient gets up too quickly, or if they take too much of the drug, or if their blood pressure is corrected without close monitoring, their blood pressure may fall too low, and that makes the person dizzy and increases the falls. And so anytime you have a fall, again, there is a risk of injury. In elderly, the most common, almost a death sentence, I think, in particularly elderly women, is falls with breaking the hips, or fracturing the hips. It creates a downward spiral for the patient. So hospitals and nursing homes have fall precautions, fall risk assessments, and indeed when pharmacists do consultations in nursing homes and hospitals, they are tasked or have a duty to uh, agree with that risk and make a further assessment as to the contributing further injury of drug-induced falls. On top of that, we also always have to consider the use of alcohol, and alcohol use actually is quite prevalent in the elderly, and is certainly very prevalent in the general adult population, and many people fall as a result of intoxication, or even at minor levels of intoxication, there's a alteration in balance which precipitates a fall. And there may be a fall. These are not necessarily falls from heights. It's just falling from an erect position to a hard ground, or even down stairs. So we've attached to the website a two-page color document that lists some precautions that can be taken to help minimize drug-induced falls, and given a list of some common drug names as well as drug classifications to identify drugs that are associated with an increased fall risk. And so when you have a chance, take a look at that website and share it with your family. Thank you.